of Operations for the YMCA of Greater New York, and I supervise the Bronx and Manhattan branches. And I'm so thrilled that you're here and that all of you have decided and made time to join us today. The Y is committed to doing everything in our power to support the city of New York, strengthening local communities and serve those in need. This last year has been an unbelievable, difficult year for all of us and for all of our community. And we know our families in the Bronx have been particularly affected by this pandemic. We are anxious for a return to normalcy. That will be requiring protecting our communities and each other, and vaccination is one of the tools that will help us get there. The CDC recommends you get COVID-19 vaccine as soon as you're eligible, but we know our community members want accurate information about the vaccines and have many questions for doctors. To empower our communities and support our vaccination education efforts, we are honored to partner with NewYork-Presbyterian to host a series of 12 webinars to discuss everything you need to know about vaccines. For more resources, including eligibility, scheduling, and information, you can visit our website at ymca.org/vaccine. Today we will hear from Dr. Dodi Meyer, a professor of pediatrics at Columbia University Medical Center. Dr. Meyer is an attending physician at Morgan Stanley New York Presbyterian Hospital, Columbia campus, and she works in health disparities, community health, and cultural competency. She has expertise in developing and sustaining community academic partnerships for the purpose of training, service, and research. Dr. Meyer works to create and implement ways of teaching and training both medical students and pediatric residents in the field using service learning as the main education methodology. As Director of Community Pediatrics, she oversees several population health initiatives that address major challenges of children's health through the interlinking context of biology, family, and community, such as obesity, mental health, and early literacy. Dr. Meyer, thank you so much for being here today. I encourage people to use the Q&A function to submit questions that come up as you listen to Dr. Meyer's presentation. Thank you.
Thank you, Elizabeth, for that kind introduction. It's a pleasure for me to be here in Zoom. Wish I could be there in person in the Bronx. As you know, we work in Washington Heights, so very close. A lot of our patients are from the Bronx. And I want to share with you the science behind the vaccines. I know I'm a pediatrician, but I've been working a lot in COVID vaccine and community health in general. And most importantly, like Elizabeth said, is really be here to answer any questions you have. No question is too simple. And so what we try to do is I'll try to go over some slides that we prepared for you for like 20 minutes, 25 minutes, and then open it up for questions. And if there's anything you don't understand, please let me know. So maybe if Rachel, you can show the slides, we can get started. So first slide, please. So the first question we have, all of us, I think, is why get vaccinated? And I think the point of this slide is that it's not only just to protect ourselves, but it's also to protect our family, our community, and most importantly, get out of this nightmare that it's been for all of us, such a painful time, and end the pandemic here in the United States and in the world. Next slide. So when we talk about protecting ourselves, I think that at this point, we're all very familiar with what COVID can do for us. Obviously, it can cause a cold with the runny nose and the fever and the cough and the shortness of breath. Some of us get very tired, diarrhea, muscle, body aches, headaches. Some people report loss of smell and taste and sore throat. And this has been affecting millions and millions of people worldwide. So far, more than 1.5 million people hospitalized here in the United States, and very painfully and unfortunately, more than 500,000 deaths across the country. And it's important to highlight that this virus and this pandemic has caused more deaths than the wars of Vietnam and the First and the Second World War combined. What we don't talk a lot about and why the vaccine is so important is because it's not only what COVID causes when you're sick, but is the consequences of that illness. And 1 to 3 out of 10 people can have long-term effects of COVID, called the COVID haul. So as this slide shows, it can cause not only the signs and symptoms that I described before, but a lot of heart problems with heart insufficiency, kidney problems. A lot of patients end up needing dialysis, which is a machine that works instead of the kidney 3 times a week for the rest of one's life. Increased blood clots, and that can cause stroke in patients. Something that people are calling brain fog, which is problems in memory, sleepiness, but also people are describing psychiatric symptoms, so psychotic episodes and other ones like that, that we don't have an understanding of why this is happening, and a lot of long-term damage to our lungs. So the vaccine not only protects us through the illness, but also protects us through the long-term effects of COVID. And unfortunately, a lot of young people are the ones that are having this COVID long haul. And it's very hard to predict which patients will have the long haul COVID, the long-term consequences of COVID, and which don't. And the other thing that we don't think about a lot is it's not common, but there has been some reinfection. So the vaccine really protects not only against the disease, but also against the long-term effects and the reinfection if we have the vaccine. Next slide. The other thing that's important is that we always say is that it protects not only ourselves, but our family and community. A lot of people live with their parents or other elderly people, or people that have chronic lung disease or chronic heart disease, or who have too much weight for their body. And all of that are conditions that cause more serious COVID. And when we vaccinate ourselves, we're protecting those that are around us. Next slide. So the next question is not only why should we get vaccinated, but do they work? And we're very, very, very fortunate that science is so advanced that in 1 year, and I'll talk about that in a minute, why it's been so fast, we could find vaccines that work. And all vaccines that have been approved in the United States till now are very effective. And not only, again, effective against preventing against disease, but also preventing one from being, if you get the disease, because they're not 100% protective, but if you get the disease and you're vaccinated, you get mild disease. No one that's gotten the vaccine so far has been hospitalized or has unfortunately died of COVID. So the next slide is one of the ones that people ask the more is are the vaccines safe? And the vaccines have been studied in tens of thousands of people, and I'll go over what a study means to come up with a vaccine. And this slide is a little bit outdated. I just looked it up, and already in the United States, we gave 165 million doses of vaccine. 64 million people as of last week have been fully vaccinated for COVID, and not one person died or had a serious complication from the vaccine. Now, and we can talk this about in the questions and answers, but a lot of time you read or you listen on TV or in the radio that someone died after getting the vaccine. What you have to know is that unfortunately life happens and people die, and whether they die, it's sometimes not a causation that they had the vaccine and they died, but they had an illness or something, a disease occurred like a clot that was going to happen anyhow. And it's not related to the vaccine. So all the safety data that has been done in the United States and in Europe shows that there hasn't been one single vaccine related death till now. Next one. So the question comes up, how can it be done so quickly? There's no way they could have created a vaccine in 1 year. So the thing to know is that the science behind how to create vaccines are decades and decades and decades old. If you have kids or you yourself remember, we got vaccinated against polio, we got vaccinated against measles, against the tetanus. So the whole science behind vaccines is not new. And the science behind the vaccines that were created by Pfizer and Moderna that say, quote unquote, is a new science, is also a science that's been studied for the last 20, 30 years with a lot of clinical trials and investigations done. One that's about to come soon, hopefully, for children, which is against RSV, which is a virus that causes bronchiolitis, a weird name for a lung disease that causes a lot of kids to be in the hospital and a lot of mortality in children. So this is not a new science. So what happened is that in order to come up with something so fast, there are many steps that the next slide will show. If you can show the next slide, to do a vaccine. And what the government decided to do last year was to put all these steps, instead of doing them one and then wait for another and then wait the results and do another, do them all at once. So usually a vaccine takes like 20 years to develop between the moment on the left of the slide from the moment you have the research and they figure out how do you do this till the moment that is in the pharmacy or in your hospital ready to be put in your arm. So what happened was here, the research, as I mentioned, was already done. It's been done for the last 20 years. So it was very easy to get the genetic code of the virus and put it into the science of how you make a vaccine. The testing phases are phases where you say, okay, I have a vaccine, but now I want to first give it to some people to see is it safe. Then I want to give it to more people to see, does it protect you against the virus? And then I want to give it to a lot of people to see, does it give side effects? So when I talk about a lot of people, phases 1, 2, and 3, by the time you get to phase 3, you're usually testing it in 30, 40,000 people. So what they did is because there was a pandemic and there was so much virus around in the world, they were able to test that very quickly and overlap phase 1, 2, and 3. So they were testing it in different groups of people to figure out the different answers to the different questions. And then it usually, you have all the data and all the numbers and you send it to different government agencies, in the case of the United States, to the FDA and CDC to review, and they take a couple of years to figure out whether it's safe or not. And here they got together and literally in 1 to 2 months, they reviewed all the data and they say, this is safe, it's ready to go. But if you're not comfortable with that, what the states did, and in this case, our governor in New York State said, well, it's good that the FDA and the CDC looked at this, but I'm going to create a panel of experts in New York State. And then the city said, okay, it's good that the FDA, the CDC in New York State is doing it, but I want to do it in the city as well. And then in our hospital and NYP and all the healthcare systems got together and reviewed the data. So this really was reviewed by a lot of different panelists, and that's how come the vaccine came to be safe but produced so quickly. Next slide. So the next question is, if we are of a particular group, like Latinos or Black or different groups, Asian people, has it been studied or will it hurt us? Because unfortunately in the United States, a lot of the time the science hurt particular communities. And we know very sadly that COVID affected the Latino and the Black community at much higher rates than other communities. And what the government did this time is initially the studies started and it was only white people, and they said, no, we're not doing this way this time. If you want to test a vaccine, there has to be Latino, there has to be Asian, there has to be a Black community, Native American, all the people that live in the United States need to be part of your trials. And that's exactly what happened. So it was studied in people that represent different ethnicities and groups in the United States, but it also was studied in people who had different diseases, people who were obese or people who had heart problems, lung problems, diabetes, high blood pressure, to make sure that it was safe and it didn't have specific side effects in this population. Next slide, please. So this is a little outdated by a couple of weeks because we have a fourth variant, but what you'll see and a lot of people have been hearing about is that there are new variants. What does this mean? It means that the virus, as time goes by and there are vaccines, the virus is intelligent, honestly, and they say, no, you're not, I want to keep on living here. So it starts changing its genetic code to see if they can fight us more and it can be more present. And this is what a mutation, what the different variants, what a variant means. We're very lucky that the vaccines, the 3 vaccines now approved in the United States, are effective in terms of hospitalizations and deaths with the new variants, including the New York City variant. And that's why it's so important for all of us to vaccinate ourselves because, and I was lucky to be vaccinated in December as a physician. I was offered it initially, is even if I get it, I know I won't, my likelihood of ending up in the hospital or dead is very, very small. And right now we're in a race because our numbers are high still in New York City. So the more people and the more of us that get vaccinated, the less variants that can start creating because the virus won't be able to keep on mutating if we all are vaccinated. Next slide, please. So I'm going to leave this to the end. And these are different, we'll come back to this slide at the end so you can look at the different sites where you can sign up. But if you press enter, I wanted to stress this before I open it to questions that even though we're really, really making an effort for everybody to get vaccinated and answer all the questions you might have, it's very, very, very important that we continue to wear a mask when we need to, when we're outside. Right now, if you're vaccinated, you can meet indoors with another vaccinated person, but if you're inside a place or you're outside with people that you don't know, it's important that you wear a mask, wash our hands, and still watch our physical distance and try to stay socially engaged with the people we love and the people we need. So this is the end of the slides that I wanted to present. And I wanted to really open it up to questions now. And again, no question is too simple. Any question is welcome, and I'm happy to try to answer to the best of my abilities.
Thank you, Dr. Meyer. I already got vaccinated and I already learned so much just by your presentation as well. We have actually a few questions already, if you're ready. The first one is it safe to get a vaccine if I am pregnant or trying to get pregnant? And will it affect my fertility down the line?
So thank you so much for that question. That's a very important question. It is safe to get your vaccine if you're pregnant, and the studies till now showed that it will definitely not affect the fertility down the line. Now, it is true that the vaccines that are approved now have not been studied in pregnant women. Pfizer, Moderna, Johnson & Johnson are doing trials on pregnant women. Tens of thousands of pregnant women got the vaccine and nothing happened to them or their baby because already enough time passed by that babies have been born. But the recommendation we have is that you talk to your obstetrician. But there's nothing in the vaccine itself that poses a risk to yourself and to your baby. I don't know whoever asked if you already got vaccines, but pregnant women have been getting vaccines for decades. And there's no issue there. Remember that what the vaccine does is it comes into your arm. And this vaccine, what it does is it tells your defense system, your immune system, to produce antibodies, which is how we fight the vaccine. But as soon as the liquid that goes into your arm tells the immune system to start working, that DNA or that RNA or that vector that we use, these are fancy words, but the genetic code that we put in disappears, and then the immune system starts working. So there are side effects. You're going to have pain, and you might have fever, and you might get tired. And now there's something called the COVID arm. A lot of people that are getting Moderna or Pfizer are getting a lot of pain in their arm. That lasts 2 to 3 days, but the virus doesn't stay in you. So it doesn't cause a danger or illness to the baby or to yourself.
Thank you. Thank you. We have quite a few coming in, so get ready.
Is to be able to answer questions.
You've already talked about the side effects. One question is there any way to avoid them?
Unfortunately not. So the side effects is how the body shows us that our immune system is working. So for example, when we have a cold or any disease and we have fever, it makes us feel miserable, but it's really our body heating up to try to kill the virus. In this case, when you have side effects like chills or fever, or some people, like I've had some nausea and stomach ache for 2 days, it means I was actually not happy to feel that way, but I was happy saying, okay, something is happening here. My body is responding. It's creating antibodies. The other thing that can happen is, when you have an infection in your nose and your like balls in your neck or balls in your armpit, those are the lymph nodes that are reacting. And what that means is they're creating an inflammatory response. So if we get the virus, the real thing, then the body says, we recognize you. You're a bad guy. We don't want you here. We're going to attack you. So that's what the side effects mean. It means that the immune response in our defense mechanism is starting to rev up and act up. What you can do is take Tylenol or Motrin if you develop them, but you're not getting the virus. So even if you have fever for 2 days, it's just your immune system, your defense system starting to work and creating those antibodies. So when the real bug gets to you, you already know that it's a foreign person that you don't want and that you need to fight, but it's not the disease itself. So just Tylenol or Motrin.
Tylenol, yeah. I took a lot of Tylenol myself.
Yeah, me too.
Do you think the vaccine is going to be similar to the flu shot, that we have to take it every year?
It could be. It could be, because we're having so many variants now. So Moderna and Pfizer are already working to incorporate the genetic codes of the variants into the new generation of vaccine. And we might get to a state that every year we have to give it to ourselves, like the flu vaccine. It is a possibility, because
does that also include the booster shot that I've heard?
Yes, because we still don't know how long. Remember, it got approved like at the end of November. So we need a full year to see how long the antibodies that the vaccine produces last. And we don't know that yet. So we'll have to wait for the studies. If we see in September that our antibodies are starting to go down, and the virus is still present around the world, we might need to get a booster shot.
Okay. Another question for you. What percentage of people need to get vaccinated for normal life to resume?
That's a hard question. You want to get into the high 80-90% of the population. So we have a whole way to go. Now, this doesn't include the little kids where the transmission seems not to be very high, although Pfizer and Moderna and Johnson & Johnson are starting to do trials with little kids, more Pfizer and Moderna right now. But you need a very, very high percentage of the population vaccinated for this to go away.
What is the percentage of rate of vaccination currently? Do you know?
Yes. So I just looked it up. I think at the United States, we're at 18% fully vaccinated. A lot of much higher percentage of first dose, but fully vaccinated, we're at 18%. But I think once you get to 50% vaccinated, those who are eligible, and now most states are opening eligibility for everybody, we should be in a better place. So I think what President Biden has said is correct. If by May 1st, everybody could get it and people get it, then hopefully by July, we're in a better place.
And am I correct in hearing that as of the 6th, which is tomorrow, 16 and up are eligible?
16 and up for Pfizer. Pfizer is the only one that studied the vaccine in 16 and 17. All the rest is 18 and up. So for 16 and up, for 16 and 17-year-olds, you need Pfizer. For all the rest, it could be Pfizer, Moderna, and Johnson & Johnson. And hopefully before the fall, we'll have the studies from Moderna and Pfizer on younger kids so we can vaccinate the kids before they need to go back to school.
Here's another one. At least one case of a new coronavirus variant first detected in India was found in Northern California. How is the new 2 mutation variant different?
The mutations are different. So we have the New York variant, we have the India variant. It's just, there's the virus is like a little, I think you probably saw pictures, right? It's like a little ball with little spikes. And so what happens, those spikes are the ones that cause all the disease and all the damage. So the variants, that spike is a protein. And what happens with the variants and mutations is that how that protein is constituted. So the DNA of that protein is different in the new mutation. So what they're trying, and so what it does is it's easier to get to your body and create havoc, or it's easier to, it becomes more contagious, but it's all in how that spike is being built by the virus. So what the new vaccines are doing is they're trying to get all those mutations, get all the genetic codes, and include those genetic codes, those mutations in the new vaccine. It's like what happens for the flu. Every year, the flu vaccine actually looks different. So what they do is they look at all the flu viruses that exist in the world, and they figure out what type of flu, they guess what type of flu we're going to get the next season, and that's how they create the new vaccine.
You talked a lot about the side effects. One of the questions that came in is, if I didn't have any side effects, does that mean that the vaccination wasn't working?
No, not at all. So some people, yeah, I know a lot of people feel nervous about that. No, just we all react different. You know how when you have a cold, some people feel miserable and some people go along with it. And we all react different to medicine. So we all react different to the vaccine. If you have side effects, it's okay. If you don't have side effects, it's also okay. Enjoy that you didn't have any side effects.
More and more people are not having side effects, I've learned.
The majority of people do not have side effects. It's just you only hear for those who have. Yes.
Yeah. Can vaccinated people still spread the virus?
Yes, so there's studies about that. So what happens is when you're vaccinated, you won't get sick from it, or you'll get a mild illness, but you still carry it and you can give it to others. So that's why when you're still vaccinated, you want to wear a mask, because you're kind of protecting others who are not vaccinated. They are doing studies now to see how much it gets transmitted. It seems to not get transmitted a lot, but we don't have that data yet.
Got it. So we're moving along with the questions. Here's another one. I have antibodies from getting COVID. Is it still safe to take the vaccine, or do I even need it at all?
Yes, so the recommendation is you definitely should get the vaccine, because the antibodies that are caused by COVID don't necessarily create long-term immunity, meaning that we don't know how long those antibodies that your body created because of the disease will last. So make sure that you get actually the vaccine to boost that response and to create more antibodies, so it protects you for the next year, hopefully.
Yeah. Can you talk a little bit more, Dr. Myers, about the vaccine for smaller children and how that's coming along?
So Pfizer and Moderna, so Pfizer, when they did the original studies, they included 16 and 17-year-olds, but now they're doing, both were doing 12 and up to see if it's working. Then they're going down to 9 and up, and now they want to go down to 2 years old. So remember those phases that I showed you, how you study a vaccine? They're in that phase. They're in the phase of now giving it to a lot of kids and the older kids. to see, are they developing side effects, but also how effective is it? So if there's a lot of virus in the world, which unfortunately there is, they take a group of kids that got vaccinated, a group of kids that did not get vaccinated, and they compare how many got the virus versus in the group that got vaccinated versus the group that didn't. So they're in the clinical phase trial now in different ages, they're in different phases. The hope is that at least, the other piece of information I want to say with this is that the studies show that kids up to 10 seem not to transmit the virus as much. So even if you open schools in elementary schools, there's not a lot of transmission and not a lot of infection in teachers and all the other adults that are in the school. So the push is to really try to get the vaccine to 10 and up or 12 and up, so it's safe for everybody to go to school in September. They're in that phase, and we're hoping by the summer we'll get the results at least for the 12 and up so they can get vaccinated.
That's great. That's great. You know, we talk a lot about how particularly the Latino community and the African American community are very hesitant to take the vaccine. What little pieces of or nuggets of information can you give to, I know that we're not supposed to, you know, but they said we're not supposed to convince anybody to do it. But if you wanted to share even more information, what would you say to them?
I would say a little bit of what we just discussed, right? So a little bit about what are the facts. The first thing I would ask, instead of sharing information, and ask them, what are you scared about? And then try to address those fears. The most important thing for me is it's been studied in tens of thousands of individuals, and now literally there are tens of millions of people that got it, and there's no death related to it. This is not new science, you know, it's a new vaccine, but the science behind it is not new. So it's very safe. And getting COVID, we know, unfortunately, is deadly and unfortunately killing our community, right? I'm from Argentina. My compatriotas, my friends, everybody in the country cannot get the vaccine. And, you know, a lot of people are trying to travel here to get it. So it's either we get the vaccine or we run a risk of getting sick and making our loved ones sick. So I would say that's the way to go. But the most important thing is to listen to people's fears and answer the questions as they come up.
I was listening to a report that says there are certain parts of the world that don't have access to the vaccine. How fortunate are we that we actually have the ability to get it free of charge and made available? One question that came up is, can you actually get COVID-19 from the vaccine?
No. So the beauty of this vaccine, and immunologists will call that it's a very elegant vaccine. The beauty of this vaccine is it doesn't have the virus in it. So when we get the flu vaccine, it has the flu virus. It's either killed or it's made to be more mild, but it has a virus in it. The Pfizer Moderna doesn't have the COVID virus at all. It's just the coding for the antibody against the protein of the virus. So nothing in our body has the virus. The Johnson & Johnson comes with the adenovirus, and it's a killed virus as a vector. The adenovirus is a virus that can cause a cold, but there's no COVID virus in these vaccines, and that's why it's so beautifully done. Mm-hmm. And that's why it's so safe, actually, one of the reasons. The other thing I wanted to talk about safety that I didn't mention is, even after all the studies have been done, usually we study vaccine safety for 6 weeks. This, before it was approved, was 8 weeks. But the CDC is tracking safety. There's a vSafe app, and we as doctors have to report side effects, serious side effects. So we are now in April, so they've been tracking side effects since November, and there still hasn't been any serious side effect that's been reported. So they won't stop tracking side effects. So they will, you know, keep on tracking for this coming year.
I was talking to one of the Bronx residents last week, and I said to him, "Are you getting the vaccine?" And he said, "Liz, I feel that the vaccine is the same way as you get a new car. You wait until all the kinks are out of the way before you invest into it." What would you say to this person?
It's a fair, some people feel that way, and I think it's fair. Some people are scared. My only thing that I say, it's obviously it's their right and it's fair. It's just you have to balance what the risk of getting the disease is versus the risk of getting the vaccine. So we weren't as doctors all eligible to get it the first time. First were the people working in the intensive care unit and the emergency room, and I work in a clinic and primary care, so I wasn't first. But when they called me the night they called me, it was I'll never forget. It was the 24th in the morning, and I was in a family house in Connecticut, and they said, if you come today, you can get it. I drove 2 hours.
Oh my goodness.
2 hours back because I'm desperate for this thing. We all drove wherever we were. We just, my colleagues, they first texted me at 7 o'clock at night, said, if you come to the hospital till 11, you can get it. So I couldn't get it by then, but the next morning they said, you can still get it. I'm like, I'm going. So I think it's okay to wait. It's just, you're increasing your risk of getting the disease. And the worry I have now, and we all have now, is these new variants, and the variant in New York is very contagious. The quicker we vaccinate, the less variants this virus will produce. So we want to try to hurry up and get as many people vaccinated as possible, so this virus cannot outsmart us.
Yeah. There's certain concerns about people that have allergies. And is it safe for them to take the vaccine shot if they have severe allergies as well?
So that's a very good question. The only contraindication for people who have allergies is someone who had a serious allergic reaction to an injectable vaccine or medication. If that is the case, we have to see the ingredients and what vaccine or medication they got. And then we have a list of the ones that we cannot give. So only if you had what's called an anaphylactic reaction. An anaphylactic reaction is a very serious allergic reaction where you can't breathe, you need to go to the hospital. Some people have to get intubated because of severe allergy. Then if you had that to an injectable medication, you will not get the vaccine. For all the people who have food allergies or who have allergies to pollen or to insect bites and to most medications, there is no contraindication. Now, there has been a few cases of a serious allergic reaction. That's why every time you give a vaccine, patients have to wait 15 minutes if they don't have a history of allergic reaction. If they do have a history of allergic reaction, they have to wait 30 minutes. Every place that gives a vaccine needs to have a physician or a clinician on site or EMS. So even sites that don't have doctors or nurses, they have to have EMS there to be safe. And even the people who had a serious allergic reaction to the vaccine all over the world, they all got treated and they all were okay.
Can you talk a little bit about the differences between the vaccines where you have to get 2 doses as opposed to the Johnson & Johnson that you only get 1?
Yeah, it was built differently. So the Moderna and Pfizer requires 2 doses, and that was what the RNA vaccine. So that's where the genetic code is. What you get is a little bit of RNA code, a protein, to tell our body what antibodies we have to produce against COVID. And that they did the studies. In order to increase effectiveness, they needed 2 doses. The Johnson & Johnson is more of the classical way of doing vaccines. You put that little code within another virus, and the virus itself, even though it's killed or attenuated, it's called, it's made less serious, it creates a boost on itself, so you don't need to give 2 doses.
Okay, that's good. You talked also about taking the booster shot. When do you think we'll know if we're going to need the booster shot or not?
I'm imagining that we'll know that by, October, November, probably of this year. We'll start studies, and by then we'll have a sense of how the virus is doing in the world. People who got vaccinated a year ago, are their antibodies going down? So probably I'm imagining, I'm just guessing, that by the fall we would have a better sense and understanding of will we need yearly shots or not.
Well, I think that's most of the questions that I have. Oh, there's one that just popped up. I missed the second shot. What should I do?
You can still get it. So we don't want you to get it too early, but you can get it late. So if you missed your second dose, go ahead, schedule. Even if it's a month later, it's good. Remember, the second dose, what it's doing is telling your body, hey, don't forget this virus is bad. Just keep on creating defenses against it. So you can do your second dose whenever. I mean, ideally is 21 or 28 days, but if you missed it, no worries. Just schedule it and get it done.
Does it make sense to get one kind of vaccine, either Pfizer and then a different kind
No,
for the second shot?
it's not approved to do that yet. There are studies where they're trying to do a mix and match and see if it works, but right now it's not you cannot. So if you got Pfizer, you need Pfizer. If you got Moderna, you need Moderna. They are doing studies where they're trying to do that just in case we run out of vaccines, but we don't have the results yet.
Okay.
And I think before you close, I don't know if there are more questions, but just want to remember, we need to go back to the slide of the information.
I was going to ask you about that.
Yeah, I don't know, Rachel, if you can go back to that slide where it has all the websites, the Vaccine Together NewYork.org. We have a very big site where we're vaccinating people in the Armory, which is at 168 and 4 Washington. We really have reserved doses for everybody who lives in Northern Manhattan and areas in the Bronx. So it's very important. If you want to get it, we have availability there, not every day, but we do. And that's one of the websites. And I think, Elizabeth, you had other websites you wanted to share.
Yes. One of the questions that came up, Dr. Meyer, before I let you go, is also about, are there any additional information that you can give? Because there's some people that are having problems getting appointments to get the vaccination.
Yes, so we have a system. If those people, I'm trying to think how we do this, because if they reach out to you, Elizabeth, we have a system where we'll give the Y a link, a specific link that then the Y can schedule directly into the Armory for if we have available slots. Right. So that will be an easy way. And I'm sorry, I can't see your faces, but whoever is asking that question, that would be a good way for you to get the vaccines. I think we can talk after this webinar and the Y can have that link and schedule patients directly to us. If you go to the website that we just put, vaccinetogetherny.org, it's in English and it's Spanish, and it will tell you immediately if we have slots available or not. And if we do, there's a process, but you can do it. And then if we don't, make sure you check every morning, every night, because as soon as the city or the state sends us vaccines, we open new slots. So and why. There's also a website that's TurboVax, TURBOVAX, that checks all the different vaccine sites in the city and will tell you which one has room, because it's very hard to find an appointment.
It sure is. It sure is. There's another question that came up. Will the vaccine interact with my DNA in any way?
No, thank you for asking that. That's very important. Whatever is in the vaccine, whether it's RNA or the DNA, so the Pfizer, the Moderna, the Johnson & Johnson, as soon as it gets to your arm and it gives the code to those cells that have to create the antibodies, it disappears. It dissolves. That's the word. It doesn't disappear. It dissolves. So it doesn't interact with your DNA. There's no chip in the vaccine to track us. And that's why it's safe also for pregnant people and their babies.
That's so great. Well, we don't have any more questions, but I can't thank you enough, Dr. Meyer, for making the time, and for everyone that's on the call for making the time to learn more about COVID and the importance of getting vaccinated. The only way that will help our communities and our families is if we take advantage of this tool to get the vaccinations. So thank you all very much. I also wanted to mention that we're working very hard at the Y to open a new vaccination site in the northeast part of the Bronx, right across the street from Cardinal Spellman at 1250 East 229th Street in the Bronx. So we hope to see you then, or please make time to go to New York Presbyterian or Columbia to get that information and get vaccinated as soon as possible. Thank you again. God bless. Thank you, Dr. Meyer. I learned so much today. It was a pleasure.
Thank you for having me, and it's always a pleasure, and we're always here to answer any questions. So if people have more questions, please send it my way and I'll make sure.
Absolutely. Absolutely. Thank you. Thank you so much. Thank you.